Ershadi, Chief Strategy and Pharmacy Officer at Chase Brexton.
Hi, my name is Dr. Sara. I'm a family medicine physician at the Columbia office.
Hi, my name is Dustin. I'm one of the clinical pharmacists working in the diabetes clinic here in the Columbia office.
Hello, my name is Sara Munie. I am one of the diabetes clinical specialists working at the Glen Burnie Center at Chase Brexton.
Hi, my name is Briana. I'm a clinical pharmacist, a part of the diabetes clinic at our Mount Vernon location.
So diabetes, in a very basic explanation, it's a chronic, which means long-term health condition that causes high blood glucose, or we commonly say sugar. So it affects how your body turns food into energy. So in a normal process, when we eat, your food's broken down into glucose and then it goes into your bloodstream. That raises blood sugar levels, and then it sends this message to the pancreas to release insulin. Insulin's a hormone that's released. So the insulin works kind of as a key function to help the blood sugar find its way into your body's cells, and that's what gives us energy. The problem is when you have diabetes, this mechanism doesn't work like that. Either your body's not making enough of insulin, or the insulin is just not responding properly. And when that happens, then that leads to high blood glucose levels in your readings.
There is mainly two types of diabetes, type 1 and type 2 diabetes. Type 1 diabetes is an autoimmune disease. So it's when your body attacks the pancreas cells and they're not able to make any insulin that is able to sustain your blood sugar. Whereas the majority of our patients are type 2 diabetes, in which you might still have functional cells that make insulin, but it's not enough for your body to control the blood sugar. There's also other types of diabetes that are variants or a mixture of the two, but the right diagnosis is important in order to treat your disease.
Over time, as you get older, typically your risk of insulin resistance will go higher. And this can be because of many different risk factors that you control and risk factors that you cannot control.
More of our common type 2 diabetes patients, a lot of them based on their carbohydrate intake, if they're, genetics as well, can put people at risk factors, also heavier weights. So those are the type 2 is what we see in our patients as they become a little older, versus type 1 is usually diagnosed in our children because of the autoimmune pathway of it.
Diabetes is also a lifestyle change that will challenge you to rethink your relationship with things like food, exercise, medication, and your overall health. It's a commitment to always being mindful of how or what kind of foods or certain foods that you eat, such as carbohydrates or simple sugars or complex sugars, as well as finding ways to always stay physically active. It can be a burden for some people. People that have diabetes generally make something like 180 decisions every day regarding their diabetes. So that's something like one decision every 5 minutes, which can be overwhelming for some people. But the longer that you live with diabetes and you work on your diabetes, these decisions will become easier over time and hopefully will become second nature.
Insulin is the hormone that's secreted from the pancreas. And so a pancreas actually has two really important roles. It's the role in diabetes in the endocrine system, but also if you heard about pancreas, like pancreatitis, that's a role in the digestive system as well. So insulin is really, like I said, the key component that helps turn that food into energy and essentially just control your blood sugar levels. When we say blood sugar, it's the same thing as blood glucose, and that's the main sugar that's found in your blood. And it's a vital role for us, and it's our primary source of energy.
So when it comes to how your body uses insulin to use sugar, we can think about insulin resistance using a ratio, for example, of how much insulin you might need to use one piece of sugar, for example. Now, this is just an example. This isn't actually how it works, but this is a good way to think about how insulin resistance will affect your body's ability to use insulin. So let's say in a person that does not have any insulin resistance, they may need one piece of insulin to use one piece of sugar correctly. And so long as you have enough insulin, your body's able to use sugar totally fine. But over time, as you develop this insulin resistance, um, instead of one piece of insulin for one piece of sugar, you may need something like 2 pieces of insulin for one piece of sugar, or 3 or 4 or 5 pieces of insulin for one piece of sugar. And so what that means for your body is now your pancreas has to work extra hard to make more and more insulin. And over time, that can cause a lot of stress on your pancreas and ultimately cause damage, which may mean that your body is less able to make as much insulin as it did before, but you still need a lot of insulin. In people with type 1 diabetes, their type of diabetes causes their body to stop making insulin completely, very quickly. And so when you don't have enough insulin to use the sugar that's in your blood, naturally what will happen is that sugar will start to build up in your blood vessels, and your body isn't able to use that sugar. And as Dr. Connor mentioned earlier, sugar is your main source of energy. So if your body isn't able to use this energy, sometimes you can feel very tired or weak. And that can be a symptom that your diabetes is not very well controlled. And over time, that sugar, as it builds up in your body and stays there and isn't used, it can start to damage parts of your body as well.
One thing to keep in mind is that that many people do not have symptoms. It's actually 1 in 5 people don't know that they have diabetes. But when you do start to have, and that's because the symptoms can take years and years before they are pretty severe. So when someone comes in and they have symptoms of very high sugars, it's typically they've been having increased thirst, increased urination, especially at night, a rapid weight loss that they haven't been trying to, kind of unexplained weight loss, blurry vision. I've seen people will come in with numbness and tingling in their fingers and their toes. The other thing, some people just come in and they just generally feel very unwell. Some report a history that they've had sores that don't heal well. They've had kind of infections more than usual. So kind of putting that all together would raise my suspicion, that it's a new diagnosis of diabetes. But like I said, it's important to remember that not everyone presents like that. So that's why we screen people who have, certain risk factors.
To understand some of the symptoms when your blood sugar is extremely high, you should also understand how insulin works in your body and sugar. If your body isn't able to use sugar from your blood, then you may notice that you feel thirsty or you want to pee a lot. And that's because the only way to get rid of all that extra sugar that's in your blood, if you can't use it, you got to get rid of it. And so the main way that we get rid of it is through the urine. And so you will find that you will be going to the bathroom a lot in order to get rid of that sugar. But because you cannot pee out pure sugar cubes, your body will start to pull moisture away from other parts of your body. So you may notice that your eyes are very dry, and that can make your vision a little blurry. You might notice that your mouth is very dry as well. You might notice your skin becomes very dry. And that's just because your body is pulling moisture away in order to dilute that sugar so you can pee it out. And that will also cause you to feel very thirsty as well. And because you're not able to use the energy or really the calories from sugar, you may notice that you may lose some weight very quickly in a very advanced stages of diabetes. And that's because those calories are just getting wasted into the urine, and your body has to find other ways to give itself energy. And that can mean breaking down your own muscles or fat stores to provide it energy. And so sometimes people can lose a lot of weight very quickly if the diabetes is extremely uncontrolled.
Another way that unfortunately patients might find out that they are diabetic is when they go into a diabetes emergency called diabetic ketoacidosis. In that stage, if your body is, for example, under stress, you've had an infection, or you don't have the medications that you need, your body will accumulate a toxic type of substance in your blood that can make you sick. And those symptoms can include nausea, vomiting, really bad abdominal pain, getting headaches, anything like that, that will usually result in patients being admitted to the hospital and needing insulin. That's one other way that diabetes can be diagnosed in our healthcare system as well.
So I think to kind of reiterate what Dr. Connor was saying, that a lot of people don't know. So that just stresses the importance of, getting checked out, because then you can catch it early. So a lot of these cases that we're talking about are when people are very uncontrolled and they don't know, to the point where you are in the hospital. So we do see a lot of patients that are new diagnoses, very high A1Cs, because they just didn't know or they didn't have any symptoms. So just making sure that, we are checking so that we can catch things before they get to the extreme.
So risk factors for diabetes. One is being overweight or obese, advanced age, which a typical cutoff we see in like age 45 and older. Family history, a parent or brother, sister with diabetes type 2 puts you at higher risk. Not being physically active, that's defined as less than like 3 times a week. A history of gestational diabetes, which is diabetes during pregnancy, puts you at higher risk. High blood pressure, high cholesterol, specifically triglyceride levels, fatty liver, race, see higher rates in Black, Hispanic, Latino, Asian, and Native American. So those are the major risk factors for diabetes. So in those patients, we will definitely be screening for diabetes with usually with a fasting blood glucose level.
To add to Dr. Connor, some of those risk factors are things that are modifiable. So a lot of those things are things that we kind of focus on, that we'll talk about in a little bit, as far as what do we do once either you're pre-diabetic or diabetic, is thinking of the risk factors and what things can I change to improve that.
When it comes to pre-diabetes, managing a lot of these risk factors are most applicable to people who have or are going into type 2 diabetes. When you have type 1 diabetes, generally you're diagnosed when you're very young, before you've had a chance to really develop a lot of insulin resistance. And so because of the way you develop type 1 diabetes, which is through an autoimmune disorder, it doesn't really have a lot to do with insulin resistance in the beginning. And because of how quickly you'll go from not having diabetes to having full-blown type 1 diabetes, there's not really a pre-diabetes period for that. Now, it is possible for people who have type 1 diabetes to develop insulin resistance as they get older. And so a lot of these tips that we will discuss in a minute will also apply to those people.
The first thing that we look at is just lifestyle changes. We'll look at what they're eating, look at, trying to exercise. Weight loss does improve those blood sugar levels. So those lifestyle changes are the first thing that we look at and start with.
So if you find out that you have prediabetes and you want to prevent progressing into full diabetes, then what we're trying to really manage is manage 2 things. We're trying to manage the insulin resistance that you might be building up, and we also are trying to protect your body's ability to make insulin. In people with type 2 diabetes, damage to your pancreas typically happens over a long period of time. So that means that you have more time to kind of reverse some of this damage before it becomes very permanent. You want to work on these modifiable risk factors in order to prevent any kind of permanent damage from happening. And so not only will things like controlling your diet and getting exercise, but also things like stopping smoking or limiting your alcohol will go a long way in reducing this insulin resistance, which can ultimately lead to damage to your pancreas and then progress you to full-blown diabetes.
One thing I want to add is the whole idea of controlling diabetes is mainly for protecting your heart or reducing cardiovascular disease. In addition to diabetes, you also want to manage other chronic conditions such as hypertension and cholesterol. All 3 go hand in hand together with obesity and increasing your chance of cardiovascular disease. Therefore, you need to have a bigger picture in addition to controlling your blood sugar.
when we diagnose a patient with prediabetes and they are overweight or obese, we start to set just, small goals. So, first try a goal, let's lose 10 to 15 pounds. I mean, that's going to help reduce your risk. To cut the risk in half, we look for a goal of like a 7 to 10% weight loss, according to, like I said, as long as you're overweight, because there are some patients who are not overweight and can still be diagnosed with prediabetes. The other main thing is really looking at diet, incorporating healthier foods, fruits and vegetables, lean meats or plant-based sources of protein, less processed foods, less added sugar. And the other thing is being active. Our goal is 30 minutes a day. I always tell patients when we're saying be active, it doesn't necessarily mean you have to join a gym and put hours in, at the gym every day. Start with small goals, taking the stairs, going outside if you have kids, playing with them, for a little bit. I do have a lot of patients say, well, I'm active, at work, I'm moving around, and that's great, but I still want to do something extra, put that on, make it another habit. Start small, 10 minutes, build up to 20 minutes, 30 minutes of just walking is really a great way. It's lifestyle changes, it's nothing that's a quick fix. So just start with, small attainable goals. Many of my visits, I am giving a new diagnosis of diabetes. And the first step is I say, let's take a deep breath, remain calm, because a lot of people are very scared. They're scared because they've either had friends or family who they've watched have diabetes and devastating outcome, or they're scared because they just don't know a lot about it. They don't know, how is my life going to be different? So that's why we're there. We're there to walk you through that. There's different levels of diabetes in terms of control. So if someone comes in and it's a new diagnosis of diabetes and their A1C, which is a test we use that shows us what your sugar has been on average over the last 3 months, if it's not extremely high, we would say it's relatively controlled. There's ways we can manage diabetes with diet alone sometimes. There's oral medications we can start with someone on. If someone comes in and it's a very uncontrolled case of diabetes, yes, it's a little bit more intense therapy. We will give you, a glucometer machine to start checking your sugars. That's the finger pricks. You might need to do injections with insulin. But like I said, it's different scenarios for each patient. I think a lot of patients, when I say, give a diagnosis of diabetes, their mind goes straight to insulin shots. My life's going to be turned upside down. And it can be very, overwhelming at first. So like I said, we just kind of break it down, walk you through all the steps, and as needed, we'll get you into the diabetes program.
How you take your first steps with a diagnosis of diabetes can depend on what type of diabetes that you are diagnosed with. If you are a young adult or a child that has been diagnosed with type 1 diabetes, chances are you were diagnosed after being admitted to the hospital. And in that case, there will be a short period in which we will very quickly ramp you up into learning all the different parts of how to treat type 1 diabetes. Now, unfortunately, currently we only really have one type of treatment for diabetes, which is insulin. And so people who are diagnosed with type 1 diabetes will have to go on a lifelong regimen of insulin, blood sugar testing, and a lot of math to try and figure out how to match their insulin. Typically, they will be meeting with an endocrinologist, and they may be set up with pieces of technology that we have, such as insulin pumps or continuous glucose monitors or CGMs. And so for those patients, there will be a lot of learning and a lot of growing pains. But since you're starting at a very young age, typically you will be have a lot of practice as you get older.
I would say the general first step is, of course, having a very detailed and honest conversation with your provider in terms of what your treatment course will look like, where you are right now, where you stand in terms of your uncontrolled diabetes and what needs to be done in order to get you controlled. Dr. Connor said it might be a combination of things, both oral and injectable medications such as insulin and other injectable medications available as well. So having that honest conversation in terms of what are the barriers that might come up with medication adherence, how do we work together to get you on the appropriate medications and get the sugar lower to where it needs to be, is the first step that needs to happen.
You know, looking at everyone as a whole, we also think about preventive health. So not only with the diabetes, but making sure that we're protecting your heart and getting you on medications that do decrease your, risk of having cardiovascular disease, making sure that we're looking at the kidneys as well, because diabetes type 2 can affect that. Immunizations, we're in the season now of making sure everyone is safe. So there are, as being a diabetic patient, it does put you at risk for other things. So we want to make sure our patients are getting vaccinated, other screenings like checking our feet and our eyes. So we make sure that we get you in the right places and the right specialists so that we can make sure that no further damage is done.
Once you've been diagnosed with diabetes, one of the most important things that you can do for yourself is to know how your body works, as well as how other things will affect your body and your blood sugars. And in order for you to know whether or not your new medication is working, or your diet plan is working, or your new exercise plan is working, you have to test your blood sugars to make sure that you can keep track of your progress and to see what's working and what's not working. And so a good diabetes regimen will often include consistent and predictable blood sugar testing at specific times. And so you'll want to keep track of your blood sugars and bring them into your future appointments to make sure that you and your provider know exactly how you are progressing with your diabetes, and know also when emergencies might happen, and what to do in cases of very high or very, very low blood sugar.
Diabetic management program is a holistic program for caring of the patients who have diabetes. As you can see, we have providers, clinical pharmacy specialists who are really the core, in addition to the nutritionist, the social, the outreach navigator that we have, as well as nurse educators. Right now, we have diabetes program at our Columbia Center, as well as Mount Vernon and Glen Burnie. Our plan is to initiate the same comprehensive program at our security score, sometimes starting January.
So how do you sign up for the diabetes program? There's a couple different options. If you have been recently diagnosed with diabetes and your primary care doctor is unaware, certainly let them know as soon as possible. And you will see your primary care provider, and then you'll be evaluated if you're a candidate for the diabetes program. Most people are, because there's so many different services that we offer: nutritionists, clinical pharmacists. We have eye exam screening. We provide help with setting you up with a glucometer, the machines to check your sugars, and providing lots of education. So you certainly can send a portal message to your provider. You can call and let the team know that you're interested in the program, and then we will put the referral in and get you set up with that.
As a patient of Chase Brexton, you will also have access to all of our other services in case you need any assistance with things like medications or transportation. All the members of the diabetes clinic team are well versed in all the services that Chase Brexton is able to provide, and we are able to help coordinate services or assistance for things such as our Every Meals Matter program that makes sure that our patients that are struggling with food security have access with food that is shelf stable and readily available. We have our social worker teams that can provide assistance in affording medications, coordinating transportations, as well as our dietitians and nutritionists who can create customized meal plans specific to your situation, cultural beliefs, or any other types of restrictions or preferences that you have.
If you're a part of the diabetes clinic program, in addition to making sure that you're on the correct regimen to control your blood sugar, or at least working with you to get you to where you need to be, we can also help navigate through the formulary and the insurance challenges that you might encounter with a lot of the diabetes medications that we use. We can help with accessibility in terms of cost of medications, patient assistance programs. So we're here to help to make sure that you are on the right type of medication and you're able to access these medications.
You
Thank
guys,
you.
that was,
Everyone.
you guys were
Bye.
Bye-bye.
awesome. Thank you.
Bye.
Thank you.